The life-saving effects of psilocybin, how the popular hallucinogenic can be used to treat both mental and physical illness, by Carter Asnian, Nicole Bullock, Benjamin Kupfer, Emma Strobin, and Daniel Zeiter. As we've already discussed throughout the semester, fungi are amazing organisms that are capable of producing extraordinary things. They can evolve to produce life-changing effects on the world we live in, and luckily, due to their constant change, psilocybin was naturally produced. Psilocybin potentially has many positive effects for users. Yet, unfortunately for most people, the use of magic mushrooms is restricted and the capabilities they possess are not fully understood. Psilocybin has been used in multiple cultures for over hundreds, possibly thousands of years in a variety of ways. Many records include the use of the mushroom in ceremonial and religious contexts. Possible examples of psilocybin use in these ancient practices were Mayan mushroom stones, or Aztec Teonanactl, or God's flesh. Various Old World European records describe the effects of psilocybin with little evidence to properly identifying the species. The effects of psilocybin are highly variable and depend on the mindset and environment in which the user has the experience, commonly referred to as settings. There are also physical effects when using psilocybin. These include things such as pupil dilation, changes in heart rate, changes in blood pressure, changes in stretch reflex, nausea, tremors, and dysmetria, which is the inability to properly direct or limit motions. Users may also have perceptual distortions, which include things like changes in the subjective experience of the passage of time, an increased sense of connection to others, nature, and the universe, intensified emotions, paranoia, and visual and auditory hallucinations. Psilocybin results in a large tolerance rapidly after as little as one use. This tolerance usually fades over time but can last anywhere from days to weeks depending on the quantity taken and personal factors like diet, weight, and current medications. Unlike other drugs, the use of psilocybin rarely leads to an increased drug dependence in later years and has not been shown to produce any physical dependence after initial use. Some research has been done in the past that has demonstrated the positive effects of psilocybin. One example of past research is the Marsh Chapel experiment. This experiment was conducted in 1962 at Boston University's Marsh Chapel. The experiment was primarily investigating if psilocybin would act as an entheogen, meaning inducing a spiritual experience, in subjects who were religiously predisposed. The experiment was conducted using 20 graduate student volunteers. Half the students were given psilocybin while the other half were given a placebo. Every member of the experimental group reported profound religious experiences. The Concord Prison experiment is another example of past research of psilocybin. It took place between 1961 and 1963 in Massachusetts. Its purpose was to see if psilocybin combined with psychotherapy would have any effect on the recidivism, recurrence of committing crime, of inmates once they are released from prison and put on parole. Prior records from the Concord State Prison suggested that 64% of the subjects would return to prison within 6 months of their release. However, after 6 months of being released on parole, only 25% of the subjects in the experiment returned to prison, with only 2 prisoners returning for new offenses. Additionally, prisoners took a personality test, and the results showed positive changes in the prisoners after being treated with psilocybin. Along with those 2 very well-known experiments concerning psilocybin, much of today's psilocybin research focuses on the medicinal benefits of psilocybin. This experiment, conducted in 2017, focused on the connections between psilocybin use and depression. 20 patients enrolled in an open trial of psilocybin for treatment-resistant depression. The patients then participated in a 6-month follow to measure their progress. Patients also reported that conventional methods of treatment, such as therapy of medication, furthered their feelings of isolation, while psilocybin strengthened their feelings of solidarity. The objective of this trial was to identify the value of psilocybin as a treatment for depression. Results from this trial showed that patients' attitudes about their depression switched from disconnection to acceptance following treatment with psilocybin. These results indicate the use of psilocybin may work in alleviating the symptoms of those whose depression refuses to yield to conventional treatment methods. This recent article from the New York Times indicates that serious news outlets are beginning to pay attention to and take note of the possible benefits and or effects of this hallucinogen. Researchers at Johns Hopkins University have suggested that psilocybin, which is found in hallucinogenic mushrooms, be reclassified from a Schedule I drug with no medicinal benefit to a Schedule IV drug, which is akin to prescription sleeping pills. Along with the article on the previous slide, these are all recent articles from major news outlets that showcase their increased interest in using psilocybin as a form of alternative medicine. something that was deemed as insane by many practitioners in the medical field only a few decades ago. While we have discussed the many possible benefits of psilocybin, the potential problems with it should not be ignored. While toxicity of psilocybin is relatively low, there are still harmful effects that can occur under the influence of psilocybin, including an increased risk of developing mental disorders after use, physical harm to others and oneself, potential birth complications, which is understudied, and acute psychotic episodes, also known as psychosis. The connections between psilocybin and mental illness remain yet to be understood due to laws and regulations that were put in place to hinder psilocybin research. Despite promising preliminary results due to the negative connotations surrounding psilocybin, we may not see extensive research into this topic for many years. Concerning medicinal use, alternative methods such as psilocybin can be beneficial to look into because conventional medicine doesn't always yield results for everyone. However, with multiple studies beginning to show a connection between psilocybin and the growing acceptance of death and/or lessening of depression, we may begin to understand more about the benefits, side effects, and properties of this fascinating substance.